My name is Saran, and today we're going to talk about respiratory distress. Specifically, I'm going to talk about pneumonia. Here we see basic human lungs. You got your trachea right there, coming out into your mainstream bronchi, your secondary bronchi, which also leads to your alveoli. There's a better picture of what your alveoli looks like right there. And this, presumably is what it looks like on a healthy adult lung. Um, Here we got another picture of it. Again, lungs. This is what an alveoli looks like on a healthy adult with sac-like structures. That's basically where the gas exchange happens. Right here, moving on down, I got a picture of what the alveoli would look like with pneumonia. So basically, when pneumonia is an infection, it's an infection that leads to the inflammation of the bronchioles, which is the bronchioles right here, and which leads to mucus secretion and fluids being built up in the alveoli, which is going to hinder the gas exchange happening in the alveoli. And when we breathe in, we're going to breathe in oxygen. And since we have fluid in our alveoli or in our lungs, it's going to be really hard for those oxygens to get to the bloodstream. And so basically, another thing, when we go out on a call, we're going to assess our patients like we always do. You walk in, you're going to get the general impression of your patient, how your patient is presenting, what they look like. You're going to get your baseline vitals, see if they're having, most of the time, they're going to tell you they're going to have difficulty breathing. And you're going to listen to their lung sounds, and you're going to expect to hear crackles or wet lung sounds. Some signs and symptoms are fast heart rate. They're going to have a fever, chills. They're going to be coughing. Your oxygen stat is going to be low in your pulse ox, and they're going to be working to breathe. And another thing is sometimes they might complain of chest pain. And how we can treat this on scene is obviously we're gonna get them started on some oxygen therapy, see how that works, to see if we can get their oxygen to work, their oxygen level up. If that's not working, if that's not helping, we move on to the next thing. We're gonna do a duo nebulized treatment, which is going to be buterol and atrovent, which are bronchodilators and see if that helps bring up their O2 stat. We're also going to give them Decadron, which is steroids, see if that'll help as well. If none of that, if the O2 stat's still not where we want it to be, and the patient's still having difficulty breathing, we're gonna move them to a CPAP. We're gonna put them on CPAP and push all the fluids out of the lungs. And we're gonna monitor that, see if that helps, and we're gonna transport them to the hospital, get them to the right facility so they can get treatments for their problems. Another thing we can do is we can give them, before we start patients on CPAP, we can give them some nitro as a vasodilator. So when we put them on that CPAP, all the fluids we're pushing out of their lungs has somewhere to go. Okay. Thank you very much. This is Saran signing out.